this is documenting this process has been a very important thing to Max and Peter and Ash and I. We're deeply passionate about the project, and Ash actually won a SEGRA challenge where this was part of the considerations in terms of changing people's behaviour. And so it's lovely to have everyone here, and we are recording it. SEGRA has a YouTube site where we put all these sorts of videos, and it would be remiss of me not to recognise the support we've had from Sturt University as part of the conduct of this. Delighted to have Professor Max Finlayson, who formerly was the director of the Institute of Land, Water and Society, and I'll get Max to introduce himself shortly. And then we have Peter Waterman, who is many things and done lots and lots of field work and consultancies in a range of areas. And then there's myself, Peter, and I are adjuncts at the Sturt University, but we got involved in this with our SEGRA hats on. For those who don't know, SEGRA stands for Sustainable Economic Growth for Regional Australia, and I'll talk later in the video about how SEGRA has been positioned in this space. I'm the chair of the National Steering Committee, and Ash is a member of the National Steering Committee, and Peter's a former member of the National Steering Committee, which makes me wonder why I didn't rope in Max at some stage, but there you are. So look, welcome everyone, really looking forward to it. And I'll get Max, if you could introduce yourself and then lead off. Thank you.
Thank you, Kate, and thank you for the opportunity to share the information on this project. I'm a wetland ecologist. Basically worked on water issues, water pollution, and then moving more into people's use of waterways, wetlands, rivers, estuaries, etc. over a long time now. And this project has sort of come about by that combination of interest with other people, such as Peter and Ash, for example, through our joint interest in climate change, what the impacts of climate change are, and particularly how can we adapt to such issues. So in this presentation, I'll be talking through the slides, and when I get to the end or near the end, we'll have I'll bring Kate, Peter, and then Ashley into it to give some concluding comments and pull out what they think are some of the most important issues. I won't necessarily cover all those issues. This project has been run over about various parts of this project have been run over about 5 or 6 years. There's a lot of work in different parts of Australia. We'll use several examples only of that to try and bring out some of the key lessons and issues for the future. So let me start by thanking Peter, Kate and Ashley for their contributions and their involvement in the project and other activities over many years. While Kate hasn't roped me into the SEGRA Steering Committee, I have been associated with her and other people for some time, and I've appreciated those opportunities. So let's get to the topic. The shorthand title is Bringing Safe and Secure Water to Your Region. This is to try and bring out the fact that what we're talking about from several examples does apply elsewhere across Australia, inland Australia, rural Australia. So the longer title is given at the bottom of the slide, is Securing Adequate Safe Water in Rural and Remote Regional Australia, looking at science and technology alongside attitude and behaviour. And to start with, we'll focus mainly on the science and end up with some issues about attitude and behaviour. So there's an imbalance in the emphasis to these things, but the science and technology, I think we're well aware of in many cases, if not most. Attitude and behaviour will be the issues that will drive the future and some of the uptake of these outcomes and addressing the problems. And the slides won't move, Kate.
They were before, so
Yeah, they were, weren't they?
have another go. I can't change the sharing options here.
Here we
There you
go.
are.
Here we are.
Thank you. Setting the scene. This is some of the background information. I'll quickly go through these three major comments here. The sufficiency and quality of water resources for domestic purposes in rural and regional Australia, that is domestic, the use for people themselves, not for industrial purposes or agricultural purposes, is largely unknown, and the potential health risks arising from this situation are poorly dimensioned. We know there are health risks. We haven't really, as a nation, dug into it in a lot of depth to really tease out what the issues are and how we can address them. This has implications for economic productivity and, importantly, for the quality of life for people in the bush or regional Australia. Assured supplies and reduction of health risks from unsafe water should be a priority across regional and remote regional Australia. This is our view on this. It's a key issue. There are not a necessarily large number of people involved in inland Australia. As you know, most of our people live on the coast in large cities. But there is an issue for those people there, or some of those people who live in these areas. Now we have the same problem. I don't know what it is. Oh, I did it a different way. But it's not just about town water supply. We know that many people in regional Australia live on properties or have enterprises that are not connected to the town grid. They're not serviced by the council water systems. So this non-grid water supply is a critical issue and is the main emphasis for our work to date. But it's also not simply how much water is available. We know there are issues about water availability. Health issues need to be considered alongside the issues of reliability of supply and in the face of a warming climate. The two graphs on the right-hand side of the slide show the annual mean temperature anomalies in Australia. This is at Australian scale data, and the rainfall one at the bottom, showing just variations in our climate. We don't have to argue and talk about the drivers of climate change. We are measuring variability and major changes. The temperature one here is the more obvious trend. Rainfall, as we well know, and this year has shown it, is far more variable, but we do have a lot of dry periods we have to contend with. And as the ABC News article on the bottom left of the slide shows, when we rely on rainwater tanks for water supplies, many people do, there can also be issues when that water gets too hot. What's the bacterial load or the disease load in these tanks, and how will that change under changing conditions? So we know a lot about the reliability and variability in the climate. We always want to know more. We always rubbish the Weatherman or the Met Bureau and their predictions, but I think they're actually doing a great job with difficult data. Australia's a big continent with a lot of variability. And we've also been able to work out the trends and get increasingly better at the projections of change. So this map shown here of Australia is the trend in total rainfall. And this is really much the same year after year of our projections or predictions. There was a drying pattern in central to eastern Australia on the whole, and in southwestern Australia, or the western part of Western Australia, coastal part there. This is well established. It's an issue for the future. It doesn't mean there won't be rainfall. It means there's less rainfall and possibly more variability and extreme events. Our interest within that context is how will off-grid domestic water supply be affected across regional Australia under these climate conditions. The news clip given here, just for Tenterfield, showing a dry landscape. This has been replicated across large parts of Australia in the last few years, not this year, obviously, but when it's dry, we have major problems. The benefit for people in rural and remote regional Australia. Too many R's rolled together there. So from this project, the Safe and Secure Water Project has its core purpose, the reduction of the problems with this water supply. Poor quality domestic water supply from rainwater tanks in urban areas is also of relevance, but our interest here is mainly on farming and pastoral properties and other remote enterprises. We recognise that in the urban areas of Australia, there's been increasingly uptake of rainwater tanks as well. So some of the issues will also apply there. They may also have some other issues. But the core benefits for all people living in or passing through, visitors in other words, through rural and remote areas from the project or from the responses to this type of project are enhanced understanding of the quality of the water resource being used, how good is the water, more effective management of these sources for domestic purposes, better focused health promotion to try and avoid or overcome some of the problems, and ensuring protection of people using the diverse range of private domestic water resources that are available in regional Australia. A lot of our work focused on rainwater tanks, but we also recognise that people and have information about people who get water from other sources, from farm dams, from streams, from aquifers, etc., or bores, etc. There's a lot more work to determine the actual source of the water for many, many people. So rainwater tanks, these are a feature of Australian or inland Australia. We know about rainwater tanks. We've had rainwater tanks for a long time. The estimates at the moment are about 34% or a third of households living in a dwelling suitable for rainwater tanks had a tank in 2013. The data is a little bit old, but I don't think, if anything, I think that percentage would have increased rather than decreased over that time. It was lower in the years before that. So tanks were a prevalent feature for households outside capital cities, over 44% on this data, compared with about 28% in cities. So it is a big feature for inland Australia. Let's look at South Australia. 86% of South Australian households outside of Adelaide had a rainwater tank based on this data, and 56% in Victoria. This is large numbers of people in these regions. Rainwater tanks are important. Health authorities, just to quickly get this one in, health authorities are aware of the issues with the safety or etc. of rainwater tanks. There's a lot of guidance available on our web pages. Whether people are fully aware of it or they're using it is perhaps another question. We need to promote the availability of information and encourage people to actually use this. So but there's still some questions around there. Is there sufficient guidance? Are there critical issues that we need to be aware of with these tanks? And will this situation get better or worse under climate change? The heating of the water, we think, will cause further problems, but will there, under a dry climate, be as much water? So there's still a lot of issues around there, despite the device that is already available. But making sure people access the device is a key issue. It was one of the issues we found. The communication issue is a critical part of this whole scenario. But the focusing questions from this challenge project within SEGRA, how might we provide secure and safe water for rural and remote regions? The question was contextualised by the knowledge that communities, enterprises, rural properties, etc., in these areas depend on insecure surface and groundwater resources and rainwater harvesting. This is the basic premise we're working on. So this has been, I said from the start, this has been going from about 2016. I'd like to thank our colleagues, etc., from the university, from the Sunshine Coast and Charles Sturt University, and the SEGRA Forum, the SEGRA Foundation and the SEGRA conferences, etc. The research has been undertaken, direct measurements have been undertaken in Etheridge Shire in the Gulf of Carpentaria in North Queensland, and the Northern Darling Basin and the central parts of the Central Lower Basin and the Balranald Shire in New South Wales. I want to focus on the Etheridge Shire in far North Queensland and the Balranald Shire in New South Wales. But just to highlight that we have looked at some of these issues in other regions. Etheridge Shire Council. So this is one of the two examples we want to present. The Etheridge Shire Council in North Queensland really championed the project through the SEGRA challenges and facilitated an initial pilot water quality screening and questionnaire survey across their local government area. The project focused on planning, conducting and synthesising the results of water quality sampling and a questionnaire survey. The key part, this took a lot of effort to organise. We can discuss that as an extra point if necessary. I just want to get to the key findings. I think this is real data from one shire in North Queensland. The key findings were that 33%, 1/3 of the 175 samples contained E. coli, bacterial contamination. And this was found in all the different sources of water sampled, specifically around half, 49% of rainwater tanks, 61% of surface water supplies, 55% of shallow bores and 14% of deep bores. In other words, while there's differences in the occurrence, we had this problem across this multiple water supplies. I want to emphasise this is a screening exercise. There was a need to, and the Shire was trying to look at this, but to follow up and determine how severe these problems were, or what sort of health outcomes there may be for the people involved. We weren't able to go into that part of the project ourselves. So untreated water is being used. It's almost 80% of the properties that were sampled. Only 10% of these were filtered either through natural river sands or using domestic filtering systems, and only 12% were people boiling the water before using. So there was not a lot of treatment of the water. The pilot showed that communication activities to raise community awareness from these health risks from this water supply should precede the actual questionnaires. We need to talk to the people and inform people first before actually just turning up and doing surveys, etc. In this case, there was an opportunity to go and do the surveys based on some other initiatives being run through the Shire. But in an ideal situation, we recognise fully and recommend that we get out the people involved through the local councils, most likely of the health services, and talk to people and raise the issue and discuss the issue, and not to frighten people, but to actually just raise it as an issue that we can test and then look at properly. Simple methods for reducing the health problems arising from poor water quality, such as filtration and disinfection, can be highlighted. And as I've already said, public health advice is available. The issue here is just making people aware of it so they can take those next steps to overcome the problems. A specific focus, which we did not go into, but other people were looking at in different parts of Australia, will be on the risks from microorganisms and all sources of domestic supply. In particular, I have trouble saying this one. I'm having trouble saying it now.
Nigeria.
Nagelia fowleri, that was close. That we didn't look at, but this is a key issue. I haven't got a slide on this one here. So, and unfortunately, I have a common name. It's commonly referred to as a brain-eating amoeba. This is a dramatic statement, perhaps, but there is a free-living microorganism, single-celled organism. It's commonly found in warm freshwater lakes, rivers, the soil, etc. We're not talking about water tanks at this stage, but it is an issue that we would have liked to explore with other experts through this project. It can cause a rare but devastating brain infection. This is a key issue. I mean, people die from this, children die from this. This has been highlighted in the media through Australia in the last for about 5 or 6 years ago. It usually infects people when contaminated water enters the body through the nose, then travels to the brain, and it causes this I have trouble with this word as well, having trouble with my words, a big long word today. Peter Waterman probably gave me these big long words to say. PAM is what we call this in short. So this is just not to scare people, but to raise an issue. It's a severe issue where it occurs. And we just think it should have further investigation and people made aware of it so they can try and avoid the situations. So that was the basic of the pilot study, which really got this going. I mean, remember, 33% of 175 samples in Etheridge Shire had E. coli contamination. So this is the second example coming down into New South Wales on the Murrumbidgee to the Balranald Shire Council. It's another inland dry or fairly arid area with most of the people living close to the rivers, etc., or with access to the river water for their livelihoods, etc. So the project was undertaken by the Balranald Shire Council. We were assisting the Shire Council. It was funded by the New South Wales Department of Planning, Industry and Environment and assisted by local government New South Wales under the New South Wales Government Increasing Resilience to Climate Change Program. There's a lot of words there, and the point we really want to make is that this was about a collaborative project across government, from the state government to the Shire government, with experts being involved. And it had come in through partly was the climate change program. It was recognising that there may be issues under climate change. The aim was to identify and pilot measures to mitigate the risks of increasing temperatures and lower rainfall under climate change on the provision of adequate and safe private water supplies for people in the Shire. Rural properties in the Shire are dependent on private domestic water supplies. And this is again, as in etheridge, farm dams, aquifers, rainwater tanks, and are vulnerable to the decreased adequate supply or adequate quality of water. In past years, the Balranald Shire has had to truck water to some of these properties. And this is a very expensive exercise, a necessary exercise in those years. People would like to avoid it if they can, and the Shire definitely has to worry about its budget. The project undertook a baseline assessment of risk to human health and started to look at solutions to improve water sanitation and water use efficiency, and provided material for dissemination to the people who weren't on the town water supply. So it's outside of, it's people who are not reliant on the town water supply. There was sampling in water tanks within Balranald Township, for example. The first objective was to build a sustainable institutional, local government and community-based partnership. This really is bringing people together to address the issues. Remember about the Etheridge example, we raised the point about talking to people first, getting the communication out there, raising the interest and involvement, and on the basis of that, designing the sampling programs. This was ambitious and difficult. It was a complex situation. People are spread over a large amount of area. There are issues around communication means of internet and phone and knowing who was there and who to contact, etc. So this was the project, or this part of the objective of the project was affected by restrictions on community engagement and participation. We had trouble knowing who was there, and Kate in particular ended up making up a phone list through multiple sources and help from the council, etc., and ringing as many people as possible to try and make them aware of the project and get the questionnaire part at least out to them. So that was a huge effort, Kate. I admire your tenacity there, and it worked. There are major changes in governance and project direction within the council itself. The council went into administration while we're going through this project. There's a huge change in the governance. There are multiple changes in general manager in the project. I think we had 3 or 4 people in the chair, over 5. Peter's just corrected me, in the chair throughout the project. So we had to go and talk to these people who are generally supportive, but they didn't necessarily know about it when they come and sat in the chair. So that took time and effort. And this was during the pandemic. So that direct communication, travel across borders within the shires, it was restricted, had a major impact on how we can do things. And the project coordinator within the council resigned and left as well. Now this, I'm not trying to, this just, we're raising this to show it can be difficult to do these projects. The capacity needs to be there. And we need continuity through the projects to actually get these things to work. It's not always easy. Unanticipated communication issues, I already mentioned that, how we engage with the community. How did you get people in remote areas to meetings? Was a meeting face-to-face the best way? The pandemic really put paid to that. What were the alternatives? Are the internet connections reliable, or do people want to use them, etc.? Do they have internet? Are they used to using Zoom, for example? There is a whole lot of issues about dealing with communities, I think are valuable lessons by themselves. And overall, there was a low level of interest and commitment. People weren't really aware of the problem. From our work elsewhere, we did get comments like, well, we've always had this water. This has always been an issue. I mean, if it is an issue, we put up with it, we survive. But it doesn't mean that will be the case in the future. all that visitors or people migrating into the area will be as immune from some of these problems as those who are long-term residents and are used to the water. So we really need to look at different parts or different sectors of the community as well. We also needed to develop an environmental social baseline, get the data about the water supply, the land use, the vegetation, etc. in the area. Council, some people in the council in the region know a lot about their areas, no question about that. But we didn't necessarily have the capacity in the council to actually get this data through GIS and mapping tools, etc., to bring it together so we get a picture of the distribution of where the people were themselves, what sort of properties they were on, and where the water was, what sort of water supplies, how many water tanks. If you look at the map on the bottom right-hand corner, those little red, they're actually triangles rather than dots on that scale. They look more like dots. That's the number of water tanks. It's a lot of water tanks across these properties. So we actually had to go back and prepare maps for the council and the council's use, etc., on the vegetation cover, water resource, land use, etc., to actually help inform the project and ongoing activities. Council did not have the capacity to do it themselves. That's a key issue as well. So a quantitative inventory on infrastructure, etc., under climate change was needed. It was done through a questionnaire survey and accompanying testing and the baseline mapping, etc. The questionnaire applied to domestic water use only and was focused on domestic supplies on rural and remote properties and on rainwater tanks in Balranald Shire, determining a number of households on rural properties in the Shire, depending on such scheme as VEX. That was difficult. I already mentioned that. It's part about knowing how many people are there and where they got their water from. The 201 rural properties were identified. Again, thank you, Kate, for helping us with that. With 162 having discrete occupancy. We didn't know how many people were there that were occupied. Some were managed by neighbouring people on neighbouring properties or from afar by managerial arrangements, etc. And then we had to get the surveys to people. We had a response of 51, which may seem low, but in these sort of surveys, it's actually quite a good number. Of course, we'd like to have more samples, but getting 51, it's about a third of those was a very good outcome. So what did we find out? The data. 34% use greater than 200 litres per day. I didn't actually say how much water do we use in a day? How much water can we afford to use in a day is another part of that we didn't really go into. 27% use between 100 and 200 litres, 38% less than 100, and very small number use less than 10 litres. So the size of the household didn't correlate directly with the amount of water used, although there was a trend. So getting this data and matching the data is quite important as well. How good is your data is an issue here. So where did the water come from? Most of it came from roofs and was stored in tanks, 87%. Surface water, 55%. Shallow groundwater, I think that should have been 10%, Peter, rather than 0.
No, yeah.
You got less the number off the shallow groundwater. It's a lower figure in it, but it's definitely not 0. Sorry for that. Deep groundwater was 20% and carted supply was 13%. But the big issue that a lot of people use water in tanks. 25% had, from those numbers, you probably guessed, 25% had more than one source. And of the people who were able to contact, of the 51, 39 returned the questionnaire, had of these, and 30, sorry, on the rainwater tanks part of it, and 33 responded to security as follows. The people responded to different parts of the questionnaire, slightly different numbers. And from the rainwater tank, these are some interesting figures about the health of rainwater. These points actually are largely picked up in the guidance available through the health agencies within the various states. 88% had animal droppings on the roof, 48% had trees overhanging the roof, 27% had aerial spraying occurring on nearby lands, and only 18% had first flush devices installed for their diverting the first rain, etc. I'm pretty sure from what I've gathered elsewhere, these figures would probably replicate themselves elsewhere in Australia as well. Domestic water sourced by householders from surface water was drawn from rivers, dams, which may or may not be stored in a tank prior to use. People may have pumped into tanks as well, but not necessarily. So there could have been direct use. So about 55% of the respondents used surface water, and 52% stored water in a tank, and 44% did not. So there's a mix of issues there. And it also relates to whether the water source of the surface water was restricted to livestock as well. So there's a whole series of issues that were coming out and trying to get that. So we moved from that to getting the baseline. I haven't got time to go into all those details, obviously. We actually tried to get people to use these do-it-yourself test kits, which are a screening device. They're not a definitive answer. It's a screening device. Do you need or should you look further? In other words, we had a lot. We're not greatly successful in getting these kits out. And this was part of the communications problem associated with the pandemic, but also changes in the council, which you mentioned earlier. So we only managed to get 17 samples tested, but 60% of these showed coliforms. It's a small number, but it raises an issue. It would have been great to have had more issues. In Etheridge, remember, we had over 50 samples. Further water testing, getting further water testing done is an issue. Getting to people, but getting to follow up from these do-it-yourself check kits, where do you get a more definitive sample done? Many of these areas, you just can't go to the local water quality lab. They just don't exist. They have to be packed up, stored properly, and sent to larger cities and towns. This is, again, is an issue in North Queensland and in the Murrumbidgee and in the Darling area where we investigated some of these things. So getting testing done is a critical issue. We move on to climate change. We got projections done for the Murray-Darling Basin and the Balranald Shire, and basically we can say.
Can I just interrupt? Really... Can I just interrupt? Sue has got a question.
Yes, Sue. Sorry.
Can you hear us, Sue? Sue, can you hear us? Otherwise, we might have to get you. Not sure. We've got a text. No, Sue, we can't hear you. Have another go, or perhaps you'll text it to us and we'll take it from there. A bit frustrating. I have got you on talking permitted, and we did hear you before. Sue has texted us, was wondering if you had any sense of whether the ones that sent in the samples might have been more worried that there were issues.
No, I don't have that sense. Peter may have had more communication with some of them, but I think it could have been part of it, but we don't have any evidence.
It was very difficult to engage with people. We sent out kits on request. We maintained privacy in this whole exercise. Even though there was repeated phone calls, 3 people who had requested kits still didn't submit. We had interesting discussions about the issues, talked with all the people who responded with by providing a result. There was such a variation in level of knowledge that became a fundamental issue, that people, A, didn't know about the health risks, and B, didn't really understand the relationship between changing climates and those risks, especially facing drought.
Thanks, Peter. And Sue's got another question. The number of coliform presence seems much higher in Balranald than at Etheridge. Was that correct?
Look, on the sampling data is what we have. How that applies across the entire community is not really, we can't say. We haven't got a large enough sample in Balranald. The Etheridge sample was quite high. Remember, it was only done it once, so it may vary annually or cross season, etc. as well. So we really need more sampling.
In addition to me ringing hundreds of people and sourcing phone numbers and recontacting people about the survey, etc., we did have a local steering committee, a policy advisor. We had 2 groups of local people who participated regularly, and we relied heavily on them for word of mouth. So, Sue, in terms of who did engage, they were people who were committed to the process. And so I'm not sure that we could necessarily say that they were more concerned about their water, but they were definitely very interested in the issue.
Yes, so thank you. This issues of climate change here is one we were able to get projections for the local region through various modelling and things, rather than rely on the national process. It really confirms the general pattern of the national data. We'd expect increasing temperatures and drying conditions on the whole across the Balranald area. It'll vary from the south of the Shire to the north of the Shire slightly as well, the local geographic differences. But we have this data, and it just shows domestic supplies from rainwater harvesting or rainwater tanks is unreliable, and the demand should be carefully managed to ensure that there is adequate potable water. It's not a simple matter of saying we have more roof space, we have existing roof space, or we can build more and put more tanks on. We need to look at the availability of the water and the condition of the water, or the quality of the water, and expect there's going to be dry periods. This seems a funny year to be saying that because it's wet in a lot of these areas, but it won't be wet every year. We know that. We've just come out of drought periods as well. So rain tanks are part of the solution. Surface water is part of the solution for water supply. Then you've got to look at the quality issue. But it may not be enough to give resilience to the community by itself. If there's no water, no rain, or less rain, we have less water in tanks, etc. It may be lower quality. These are the sort of questions that we were left hanging with and we're unable to pursue in this project. But there is a key issue around climate warming conditions and lower rainfall on the whole.
Max, can I just give you a time reminder? Oh, you're up to overall findings, but a time reminder.
Thank you. No, it's literature review. This basically sums up. We went through this is about a 5-year program project, and confirmed that the sufficiency and quality of private water resources for domestic purposes is largely unknown. We don't know enough about it, and the potential health risk arising from this could also benefit from being better understood. We're not trying to panic people. We're just trying to raise an issue to investigate further before it becomes a major problem. Australia-wide, the situation has been and will be exacerbated by prolonged drought and heat waves occurring from changing climate conditions, all with implications for economic productivity, livelihood and quality of life for people in the bush, which is a statement we made earlier in the project. So the short answer, this is a question. I just got a problem with my screen here. Hang on. No, it didn't solve it. The photographs of the people in the talk are overlapping my screen with the text. But is this threat acknowledged? Are health impacts from poor water quality considered to be a societal cost, and are illnesses attributed to water quality recorded and costed? That is, how much do people know about it? When people do have problems from bad water quality, do we actually get that recorded in our medical or health services, etc.? The simple answer from the Balranald experience, where we did try to investigate, is that no, we're not getting that information through the health service or the hospitalisation records about what is causing belly aches for people. Example, is it bad water or other problems, to put it in a simple way. So there's a whole issue there to investigate further as to how do we really know what the problems are from a health side, not just the water supply side. And we had correspondence with Queensland Health, for example, that there's interest in this Amoeba problem there, which can be critical, can kill people when it gets there. They're not really investigating a lot of the other problems. So there's still a lot of steps that we suggest could go further in consultation with the local authorities. Is that screen still sharing? I've got a
yes, it is, Max. I can see
Sorry?
it. I can see it.
I got a symbol saying your screen sharing is paused.
Oh,
Anyway, increasing resilience is needed. There are technologies available. There's simple ways of doing things. There's more complicated ways of desalination techniques are available, and the costs are coming down, but they can still be expensive. And we really need to talk through the issues, what we were saying here, about how to get the best out of rainfall harvesting tanks but not expect it to solve all our problems in the future. It is a part of the solution, it's not all of it. So, you know, communication activities, I think I've said this, we need to communicate this further. So I won't go quickly, I'll just go mention what is climate change, how will it affect people.
The screen isn't changing over at this stage. And I've done everything I can here to try and address that.
Let me go to stop share and then share again.
Okay.
It takes me back to, can you see that?
Yes.
I can't get the full. Okay, now I've got to find the full screen button. There it is, under the, now that one.
Yes, that's where we need to be.
This is the communication issues about what is climate change and what's it mean for local regions rather than the national picture. What's it mean locally? What do we understand about the problems or the pollutants in the water? We didn't go into water pollution from other sources in this project. It's an obvious extension. What are the impacts and what we can do about it? What are the simple ways to treat water that contains bacteria and avoid the problems? How do we manage rainwater harvesting and storage tanks, etc., and coping with climate change issues? So that's really want to get to, I might jump this because I want to get to this here to give Kate, Peter and Ashley a chance to bring this to an end. So Kate, a little bit about SEGRA and the water challenge.
Thanks, Max. So this whole project started with a challenge at SEGRA. So SEGRA is really committed to addressing sustainability in regional Australia at the on-the-ground level. So people who are involved in SEGRA live and work in regional Australia in a majority of cases, or invest in regional Australia. And we have a challenge program where SEGRA conducts challenges between events where delegates unite to collaborate to solve a specific issue. And we've had a number of challenges over the years, and usually we are able to get a university to partner with us. And so this issue of safe and secure water was brought up by many delegates. Some were based on concerns around the health of the Murray-Darling Basin system, but also originally the Amoeba, which has only recently been identified. Previously, children have probably died from the Amoeba, but it hasn't been known that that was the cause. So it's been listed as a general encephalitis rather than understanding that them playing with the hose in the front yard is causing severe problems. The other thing, again, that delegates brought up was that they noticed the health impacts if there's really hot days in terms of people going to get medications from the chemist, people presenting at hospitals. But as Max said, we weren't able to get that data beyond that anecdotal level because that data is simply not collected. And the other thing, which I think Sue's already alluded to, is that, and Max referred to earlier, is that it's often people moving into regional Australia who are appalled by the quality of their water. There's a general sense in the community that, yeah, you know, we always use tanks and it doesn't cause a problem. Although one of the people that I spoke to in what I thought was an amusing comment said that if he's got single male workers managing the property, they all just bunk in and have to use the local water. If he's got a family managing the property, he ships in water because the quality isn't good enough. So I thought that was very interesting. So water's been identified for a long time as a SEGRA challenge, and it's been very exciting to be involved in this work. And Peter's going to talk shortly, or I hope he is. If not, it's we have a huge communication strategy that Peter has developed that can be used over time in terms of media releases, etc. And we have had some coverage quite a few times now from the ABC. So there is a broader interest out there in the issues. And finally, just a little plug is that if the people who are listening have an interest in a challenge idea, SEGRA is interested in hearing it. So if you've got some ideas moving forward from this challenge, we're interested in hearing it. So thanks, Max.
Let's get to some key issues. And Peter, please.
I think we've got one before this one, Max. I think there's technical slide before this.
My goodness. Not sure I can go back. I'll work out how to go forward.
There we are.
There we go.
There we are.
Sorry.
Yeah, well, the Max has already made the point very strongly that we've got the technology to deal with ensuring that people can have adequate and safe water. Just as one simple aspect in terms of this, because we've been doing this sort of work in other places, one of the simplest ways is to disinfect water with chlorine. So people say, where do we get it? You can make it from with a very simple piece of technology that was developed for use in the Pacific Islands and Sri Lanka, where we took it for testing, was to make sodium hydrochloride from table salt. Same physics principles as for your pool. So we've got the technology, but it is, are they being used? Our knowledge is yes, gradually there's uptake, but there can be far more. And with this challenge that we know that rainwater harvesting is not going to produce enough water, we're going to have to look at more innovative ways for desal, and also to more innovative ways to ensure that people are demand management, water use for purpose. Why not? That's the question that we all need to look at. Okay, we have huge amounts of information. We've got climate change projections. In the case of New South Wales, there's the ADAPT New South Wales data for the Far West region. We looked at how that had been done, and we reconnected with colleagues that we'd been working with for many years in New Zealand, and very fortunate they donated time and effort and gave us an immediate new set of projections, both at the shire level and the ability to do it down to a property scale. So we know that that trend that Max has raised, it's going to get drier, hotter and less water. So in that situation, how do we keep that message moving through to people? And we're dealing with people who have inadequate internet connections, restricted commuter skills, poor water literacy, poor understandings, limited experience with governments and centralised information. And this latter point, the centralised information, there is a belief by many in government, because we have our web links, because we have our Facebook, we have all these things, that people out on the properties are getting the information. And what we know, and from Kate talking directly with people, me talking directly with people, they're not getting it. It's one-way communication. So how do we improve that? Well, we've got to engage with people on the land. With this project in Balranald being knocked over by COVID, we couldn't go there. We had part of the project, as a demonstration project, was to prepare a communication strategy that could be rolled out. Well, when governance fell over, all of those things fell over. So that's another story. But what we do know, and it was a lesson from Etheridge and a lesson from here, it's got to be two-way. The more you can look someone in the eye, whether it's with a computer or face-to-face, and we couldn't do the face-to-face because of COVID restrictions, it's got to be two-way communications and feedback.
And can I just draw to people's attention, Dorothy has made an excellent comment in the chat about water quality in hospitals in regional, not always regional, but regional rural Australia. So please go on the chat and have a look at that. Thanks.
Okay,
Dorothy.
good. Well, the health risks that are known at a higher level, they're being documented. We've done research in Australia, the National Climate Change Adaptation Research Facility, for example, in collaboration with others, did work looking at the heat waves and other components. So how does this translate down? And I think the big thing that we've observed, there can be a lot of information at a higher level. There can be a lot of understanding at the higher level, but when it comes down to people at the property scale, the household, the information isn't there. So there are governmental guidelines. There is an assumption, and Max and I very early in this project were discussing this with New South Wales Health. They said, oh, we've got it on our webpage. Can you disseminate it? Well, we did as well as we could. But that's an assumption from the central authority that people are getting it. We know that they're not. So the other key issue is the measurable reduction in costs that this is one of the assumptions when we started this. We thought there'd be the data available, and Dr. Teresa Lewis, one of our wonderful colleagues, she pulled this stuff together with a lot of experience in sustainable health systems. And we were quite knocked over when we found that there wasn't the coding in the New South Wales system. So we don't know what gave people tummy problems and spusies and poozies and all of those things which are there. And incidentally, in the case of waterborne diseases in the New South Wales system, once they thought they'd overcome typhus and cholera, they stopped coding them. So this remains an issue, and we're fairly concerned about this. And I don't know, we haven't investigated it in the other jurisdictions, but I know in Queensland the data is limited, and I know that so there's a disinterest. But as Max pointed out, the new Queensland Health were more concerned about things like Negeria fowlii than people getting tummy problems. But anyway, that's where it sits. We've got a health issue. At the end of the day, it's about climate change impacts on people. And that one is about as close to people you get is, will you be impacted by bad water? Will you be impacted by heat?
Thank you, Peter. And we're not going again.
Barb, you've got your hand raised.
Yeah, hi. I've been really interested in this and are really interested in it from a tech solution rather than a water, you know, we've got issues here in South Australia where groundwater irrigation has reduced quality of water access for critical human and stock need, and bores are having to go deeper, you know, more issues that come with that. We also have a lot of rainwater tanks in regional and remote, reduced rainfall, and in fact some of the few areas left in Australia that are considered still in drought. So, you know, all of those climate impacts and everything you talk about. We're looking at tech-based solutions, and one of the issues obviously with that is we don't have broadband coverage in all of our areas. So we're looking at LoRa gateways and the network as being the carrier of data. And in a conversation with someone, with one of the LoRa people that we do a lot of work with prior to this, I asked what sort of water sensing is there and whether that could be a solution, because to me, you know, they've got the solutions for stream flows and water testing in flows and, you know, all the rest of it. But to me, there seems to be a possible test case around that ag tech that we use being transferred into this house tech, and understanding the LoRa network means that it's actually fairly inexpensive to start mapping a whole lot of this stuff. And so, you know, if we're looking at, sorry, this is fairly long-winded, climate variability, water quality, we can actually have micro weather stations connected to these LoRa networks. We can have the water quality, we can have water monitoring as far as levels. We can actually then start collecting data on quality and water levels, whether it be tank. We can actually monitor the inflows into the tanks and see change. You know, we can do all of that stuff now. So I suppose I'm just putting it out there that there might be a value add that isn't as hard and can be done from afar. You know, I get that people aren't wanting to fill out surveys and go and do testing, but once this stuff's embedded, it's dashboards and alert systems and data. So yeah, I don't know, I just want to throw that out there to see whether that had been considered, how that might work. Yeah.
Yeah, thanks, Barb. We might throw to Ash now, and then I think we've got a little bit of time for some open discussion, including around Barb's comment. So thanks, Barb.
Yeah, that's a great comment, Barb. Just currently doing some work with Queensland farmers around microgrids in agriculture, and we're measuring energy associated with pumping water, and notwithstanding the great difficulties in actually getting those sensors to communicate in remote areas, I think you're bang on. There is an opportunity there. And I guess that's a segue into what I was adding to the discussion, which is really the nexus between energy and water. Very often we ignore that, but every bit of water actually has an energy budget tied to it. And so the central question around some of this, and I think again everyone's alluded to the tech, is like, well, if we're heading towards a decentralized, clean and affordable energy future, which it's pretty clear we are, particularly in a lot of regional and remote areas where standalone power systems are increasingly being rolled out, then at a point in time those power systems are paid off. I often say with renewable energy, the sun mightn't shine all the time and the wind mightn't blow, but when it does, it doesn't send an invoice. And so, that marginal cost of energy in the future reduces and makes a whole lot of things now available and affordable, which may not have been in the past. One of those may well be the provision of water. And if you're a local government who's invested in a power plant or whatever, then this might be something that you could actually look at is how would you make with your free energy, how would you make better quality water? Some of those opportunities are things like Peter had mentioned: treatment. There's atmospheric water generation, distillation, purification. There's a whole range of things. And look, I just did a quick screenshot of a Google search. There's a number of commercial operations out there. But if we can move on to the next slide, picking up on Peter's point about the social rollout of that, there's a big question about how we deliver that, and perhaps the opportunity to rethink the whole system. I'm reminded of a few years ago, a PhD candidate who spoke before me at one of the conferences. Peter was doing a study on the economic sweet spot for provision of water. And what he was saying really is that if you just tell everyone to look after their own domestic supply with tanks, that's actually across the community an expensive way of doing it. And as this study has shown, fraught with health risk, if nothing else, not to mention the availability. On the other end, if you just say, well, government's going to do it, we'll supply water to you, that is also really expensive. And his PhD centered around saying, well, what is the sweet spot between that? And I think if I recall his findings, it was around a sort of a block scale, the 20 or 30 houses coming together into a supply. And, this gets us back to the future, to villages in Europe with the fountain and that kind of idea about saying, well, hang on, if we're redefining the energy network, is there an opportunity to redefine how we deliver safe and secure water to people in regions as well? And I had a chat to a William Cully elder that's out at Broken Hill last time I was out there. It was really fascinating because I said, oh, how's it all going, energy, water? And she's gone, yeah. She said, oh, you fellas come out here and thanks for coming. I was coming to talk to me before you went and did anything, because I was asking her about energy. And I said, oh, people don't do that. She said, no, they always come out here and do stuff. She said, the latest thing, she said, I've got a whole heap of people coming into me complaining because somebody turned up one day and stuck a big atmospheric water condenser on the roof. This is from Wilcannia, Burke, all Darling, sort of central Darling country, and stuck these solar panel things on their roofs to give them a guaranteed potable water supply. She said, but they're bloody noisy. The compressor runs all day. We can't sleep. No one asked us if we wanted to do it. And you can guarantee that a lot of that technology is now sitting idle, unused, and because there wasn't any of that social engagement piece around this. And so it's not just, as I've written there, how the economics stack up, but it's actually around the whole model of supply that we need to look at here. And that means looking at what the community drivers and limitations are here. And just as a final comment, I mean, this is really interesting, fantastic being involved with these guys over the last few years around this whole project, which essentially started by looking at the implementation of the Murray-Darling plan and all of that. But really, what we have entered into is a region where, water is a limited and highly contested resource, and we're no longer able to just go and get more. But there's always going to be an argument about it, and oftentimes the way we try and solve a problem now just causes problems for someone else. So it's a bigger and complex issue that's not going away. So it's been lovely to be involved with the project. Thank you, Max, Kate, and Peter. And I'll stop talking now.
Thank you, Ash, Peter, Kate, for bringing that to an end, and your views and experiences involved in the project and your wider experiences in life. I just got a comment. While we've covered a lot of material, a lot of subjects in here, and it's about healthcare or preventative health issues, water supply, water reliability, technology. And I think, to me, that's all part of the project. But the big issue, and again comes through, is about communication and the participation of communities in these projects. Ash, you just summed it up with the Indigenous people in Broken Hill. People come and do things. Do they come and talk to us? It just raises the communication issue that we were raising slightly separately or differently in this project. So thank you, everyone. And thank you for everyone for being involved in the project over the last 5 or 6 years. Thank you, Kate.
A pleasure. And I've just popped my email address into the chat in case anyone would like to follow up on that on our discussion. So thank you all very much. It's been great to have an overall summary of what's been many years' work, many voluntary hours as well as paid hours. And thank you all very much for attending. This video will be recorded and will be on the SEGRA YouTube site shortly. Thank you very much.
Thanks all. See you later.
Thank you.
Thanks.
Bye.
Bye.
Bye.